Hi everyone. I wanted to talk to you about hand pain and how to manage it. So that's a very common issue in many people is having pain, especially the carpal metacarpal joint, which is the base of the thumb. But also some people start to notice changes along their proximal interphalangeal joints and distal interphalangeal joints. And these changes can occur with osteoarthritis. So, how do we manage hand pain? Because it's a very common location that we see for osteoarthritis. So, my recommendation and what to do is threefold. One, the most non invasive thing to do is to use Voltaren gel, which is the brand name. The generic is diclofenac. And what I would recommend is squeezing out about a pea size amount, putting it on the back of the hand, and then rubbing the hands together. And you can do that up to 4 times a day. It's very effective for hand arthritis pain because it's an anti inflammatory like ibuprofen, but because the skin is so thin, it gets very well absorbed through the hands. So I really recommend it for hand arthritis without ingesting pills. And that way, if you're a little hesitant to take more medication, you don't have to take anything and you can use it up to 4 times a day. So that's one. If you do decide you want to take something, you could also try Tylenol. So, Tylenol is one of the safest medicines out there that gets a really bad rap, and it's extremely safe. You can take up to 1,000 milligrams 3 times a day as needed. So, up to 3,000 milligrams in 24 hours. And that is a pain reliever. So, you could try taking, let's say, 500, and if it, isn't enough, then you could take another 500 for a max of 1,000 3 times a day as needed. If you're having some tingling or numbness in the hands, you could try wearing a wrist splint at bedtime. Some people notice, when they have arthritis and wear and tear, that they start getting some tingling in the hands. And so, what you could do to try to see if it gets better is to wear a wrist splint at bedtime and see if that helps also with some of that sensation. And if there's no contraindication, you try all those things, you could try an anti inflammatory like ibuprofen as needed. So, I hope this helps. This is just informational, but that is typically how I manage hand pain in osteoarthritis.